A new survey at an Israeli hospital has found that undetected COVID-19 infections are rare. Even as questions have been raised about Israel's official infection count, researchers at the Tel Aviv Sourasky Medical Center conducted antibody studies and tests on around 500 medical staff, all of whom were unaware if they have contracted the virus. According to the survey, only 2.6% of them had antibodies. Researchers further say that asymptomatic cases in general public are probably fewer than thought. Israel, after all, was one of the first nations to roll out a national vaccine campaign. More than 80% of the adult population has now received 2 shots of COVID-19 vaccines, and more than half have also been given a booster dose. The country has rolled out 4th COVID-19 shots as well, initially to the elderly and healthcare workers, and since then to all vulnerable people over the age of 18. Meanwhile, the Israeli Prime Minister Naftali Bennett has backed the lifting of COVID-19 restrictions. Due to the recent decline in daily COVID cases in the country, the infection rate has now declined, with about 30,000 new cases registered on Monday. For more on this, our correspondent Jody Cohen has sent us this next report from Tel Aviv. Let's take a look.
I'm at the Corona ward at the Sourasky Medical Center, which is also known as Ichilov Hospital in Tel Aviv. Now, doctors carried out a study here on 500 health workers who didn't think that they had had COVID since August. The hospital expected to find many with a specific antibody, which would suggest they had COVID without symptoms. However, the study actually found that only 2.6% had contracted COVID. So unlike common belief, the study suggests that undetected asymptomatic COVID infections are actually rare. The hospital is now going to widen the study and hopes to confirm the findings. This is Jody Cohen for WION World is One.
WION World is One is now available in your country. Download the app now and get all the news updates on the move.